Hi guys and welcome to an all new video. Today actually the 10th of October is the World Mental Health Day. So to celebrate this occasion I have a special guest joining me for today's video. And before you start wondering, let me tell you, ये चश्मा मैंने इसलिए पहना है because recently मेरी LASIK की surgery हुई थी. So joining me today is Dr. Rajesh Sagar, who's currently working as a professor at the Department of Psychiatry at AIIMS in New Delhi. He's an MD from NIMHANS Bangalore. He has received a certificate of completion of specialist training from Specialist Training Authority of the Medical Royal Colleges UK and General Medical Council UK. Currently he is working as a member of the Central Mental Health Authority, Government of India, and he's also an Honorary Advisor for Mental Health to Ministry of Health and Family Welfare. So let's welcome him for today's conversation, which was honestly very insightful for me as well. We spoke over Google Meet, so let me take you over to the conversation.
Hello, Dr. Sagar. Thank you so much for joining us today because this is Mental Health Month, World Mental Health Month, in fact. So I have a lot of burning questions for you on what is anxiety, what causes depression, and how can we take care of ourselves and our mental health as such.
Yeah, good evening to you and good evening to all the viewers. It's wonderful to be here. And yeah, I am a psychiatrist. I am a professor of psychiatry at All India Institute of Medical Science, New Delhi. So primarily my job is clinical care, which I provide in the outpatient clinic, and I also have inpatient services. I'm involved with teaching and training, also involved with some of the policy related work. As rightly said, we have World Mental Health Day on 10th of October, which is celebrated all over the world. So I think in that context, this discussion becomes very, very important because the idea of this World Mental Health Day is to reach out to people, to create awareness, to educate people, to talk to them. I think that's what the whole idea is. So it's
yes, absolutely. मुझे ऐसा लगता है कि जब से हमारे पूरे वर्ल्ड में ये पैंडेमिक आया है COVID-19, I think because of the lockdowns, because of you know how we've experienced life so differently, we've all started experiencing anxiety or some amount of depression, isolation in different ways. And I think that is where even I felt that I should start taking therapy. So I have a few questions around these experiences that maybe a lot of people must have had. And my first question to you is कि किसी को कैसे पता चलेगा कि उन्हें anxiety महसूस हो रही है? What are the first few signs of anxiety, and how can somebody self-diagnose or assess that yes, this is something that I need to address?
Yes, that's a very, very important point, and that is what we call as a health literacy and mental health literacy. What it means is that how much I know about my health and how much I know about specifically mental health issues. So, जैसा आपने बताया कि how to know that I have anxiety or that matter any mental health issue. I think there are certain basic things which one can see. That is a change in behavior, either to self or anyone in family or your friend. So change in behavior means that earlier you were going out, meeting people, but now suddenly you are confined to a room, you doesn't want to go out, or you have started consuming alcohol or smoking more excessively, or there is a change in your emotional health. Now you have become irritable, or you have become sad, or you have become fearful, or so that change in emotions is also an important symptom. The other than that, there could be a sleep problem, like sleep specifically that you're going to bed, you're not able to get a proper sleep, or getting up early in the morning, or frequent awakening in the night, or there could be reverse also, or you're sleeping excessively also. So that could also be a symptom, or there is a loss of appetite, or there is a weight loss also, or you are feeling in a way suspicious at times. These are symptoms of a severe kind of a psychiatric disorder. Or you are not feeling connected with people. Somewhere you feel lack of interest. So this is in general, you can make out that you have mental health issue. As far as when you asked about specifically about anxiety, what it means is you have symptoms which may be bodily symptoms like palpitation, sweating, feeling on the edge, घबराहट हो सकती है. These could be one symptom. The other symptom are related to your thought process. That is, पता नहीं क्या हो जाएगा, suddenly कुछ हो गया, मेरे घर में मेरे पेरेंट को अगर कोविड हो गया तो क्या होगा, will I be able to take hospital or not, हॉस्पिटल में मुझे बेड मिलेगा या नहीं मिलेगा. So ये सब सिम्टम्स लगने लगे और एक्सेसिव हो जाए तो कह सकते हैं कि एंजाइटी है. बट वन थिंग आई वांट टू टेल हियर इज सम पार्ट ऑफ एंजाइटी इज नॉर्मल पार्ट ऑफ लाइफ. आई थिंक आई जस्ट वांट टू मेक इट clear also. It does not mean that all anxiety is dysfunctional or it causes distress, because some part of anxiety is normal. Say for example, I am facing an interview, I will be anxious. और टीचर है reprimanded me, उन्होंने बुलाया मुझे डांटने के लिए, तो थोड़ा सा anxious मैं होऊंगा. But the point is that anyone who is feeling anxious does not mean that he has or she has anxiety disorder. So anxiety disorder के लिए अगर है वो severe है, moderate है, तो उसका मतलब ये है कि वो बहुत excessive हो जाए, आपका डिस्फंक्शन होने लगे, बहुत डिस्ट्रेसिंग हो जाए, then you feel that it's a problem. You need to seek help of your immediate people who are around you, or you may need to have a professional help in that regard.
That makes so much sense. So आपने काफी सारे ऐसे एंजाइटी के ट्रिगर्स अभी बताए जो नॉर्मल है, जो किसी को भी महसूस हो सकते हैं, लाइक डे टू डे एंजाइटी, छोटी छोटी इश्यूज को लेके. But what can be some of the issues that are causing long-term anxiety or repetitive anxiety, or like you even mentioned a disorder? So how can one know कि उनको क्या cause कर रहा है ये anxiety in the long run?
क्या होता है कि कुछ हद तक जो है, as I said कि it's a normal, but when the same thing become excessive, like you feel that it's not in my control now, and because of anxiety you are not going out and meeting people, you are avoiding certain situations, or you have become dysfunctional, or because of anxiety you are not able to sleep properly, or in the morning you are not feeling fresh, some बेचैनी जैसे symptoms हो रहे हैं, या घबराहट palpitation हो रही है, feeling like lump in the throat or butterflies in the stomach. So ये excessive हो जाए or it becomes causing a dysfunction to you, then you may think that okay, there is something where I should take help and I should seek some consultation for that. Consultation का मतलब ये है कि you can share with your friend, you can talk to your family member, you can talk to your family doctor. फिर भी ठीक नहीं होता, then of course you need to seek a mental health professional.
And in what situations should somebody seek a psychologist, or these are because two completely different branches, no?
Okay, I think this is a very important point what you raise, and I just want to explain who the psychologist and who the psychiatrist is. Psychology is a non-medical branch where a person has done a BA psychology, BSc psychology, then done the masters and doing the MPhil, whereas a predominantly psychiatrist is an MBBS doctor. He is a trained doctor first. Yeah. And psychiatry becomes a specialization, where we deal with the human behavior, making diagnosis, assessment, and management of behavioral conditions or emotional problems. The primary difference is that a psychiatrist will give medicines to you for treatment of your condition, psychological problem, psychiatric condition, as well as do therapy. So whereas psychologists are not trained to give medicine part. So whereas psychiatrist will do can give you medicine and other part of treatment as well.
That's a very important difference, I think, and I think everybody who's even viewing this video should be aware. Based on whatever they're feeling and how they're feeling, they should know how to take this forward. And I think if medicine is the answer, then for sure. अब क्या आपको लगता है कि लोगों को घबराना नहीं चाहिए इन सब चीजों से, क्योंकि I'm pretty sure there isn't enough talk about therapy and about mental health issues, and काफी लोग अभी भी घबराते हैं इन सब चीजों से. What do you think? How can people openly have a discussion about it and feel at ease कि नहीं, मुझे जरूरत है तो है?
देखिए, बहुत इम्पोर्टेंट पॉइंट है ये, एंड ऑलवेज वी से, एंड आई एम सेइंग दिस अगेन, दैट इज द वे वी टेक केयर ऑफ आवर फिजिकल हेल्थ, वी नीड टू टेक केयर ऑफ आवर इमोशनल हेल्थ आल्सो. Like suppose I have some injury or I have fever, so I will immediately rush to hospital. But emotional problems, we don't pay attention to it, and because some of these emotional problems, people think they do not want to talk. They think that अगर मैंने किसी को बताया तो लोग सोचेंगे तुम कमजोर हो. They will not think that psychiatric illness or let's say a depression, anxiety is a real illness. A real illness in the sense like you are feeling low, डाउन. अगर आप किसी को बोलोगे तो कहेंगे ना तुम्हारे बॉस ने तुम्हें डांट दिया होगा इसलिए आप ऐसा कर रहे हो. नॉट थिंकिंग इट एज अ रियल इलनेस. आई थिंक दैट्स वन ऑफ द वेरी, whereas anyone who has a pain or fever, they think that is a real illness. This type of discussion in a forum where we can interact with people, talk to people, discuss with them will take away a lot of the myths and misconception about mental health issues.
मुझे तो ऐसा लगता है कि इन मोस्ट केसेस जैसे अगर आपको कोई मेंटल हेल्थ इशू है तो आपकी बॉडी भी आपको साइंस देने लग जाती है. लाइक एंजाइटी इज सच अ क्लियर एग्जांपल. लाइक योर बॉडी आल्सो स्टार्ट्स गिविंग यू सिग्नल्स की पैल्पिटेशंस जैसे आपने कहा, या फिर feeling a certain way. So if your body is also giving you signs, then it's definitely something that you need to address, right?
Absolutely right. I think Tanya, you made a very important point. I will tell you because इस पर मैं थोड़ा सा I will take a step back in saying that body and mind हम सोचते हैं अलग अलग हैं, but they are both interrelated. Like say for example आपने anxiety की बात की, but let me give you example of depression also, where there is a predominantly a sadness. You have lack of interest, and you have lack of focusing or concentration or thoughts about harming self and so on. But at the same time, there are many bodily symptoms also, like fatigue. अगर थकावट है, तो that could be one of the key symptom of depression. Or there is a sleep problem. अगर आपको नींद की कमी है, या आपको भूख कम लग रही है, या weight loss हो रहा है, तो that also is a feature of depression. So कहने का मतलब है, whenever we have a psychiatric illness, it does have a bodily symptom, whether it's a depression, anxiety, and any kind of mental health issue. Similarly, when we have a physical illness, it does have a bearing on mental health issues also. I will give you an example. कुछ तो illnesses हैं जो बहुत ही known है. For example, thyroid dysfunction में depression is very highly related. Or even if you have a cardiac illness, a heart की disease हो, या lung की disease हो, or even for simple, like say for example, if I have fever, I am at home, I will feel low, I will feel down, because I will think मैं ऑफिस में नहीं जा पा रहा, काम नहीं कर पा रहा, तो भी मेरा मन थोड़ा सा डाउन हो जाएगा. If we have a clear cut psychiatric illness, we will have a bodily symptom. Similarly, if we have a bodily illness or say physical illness, we can have a behavioral symptoms also. So I think we need to be thinking that body and mind are one.
That's such a good point. In fact, मुझे ये तो पता ही नहीं था कि काफी illnesses के बाद भी mental health issues हो सकते हैं. Like you said, you talked about cardiac issues and all. ये तो मुझे पता ही नहीं था. So this is actually awareness for me as well. So my next question actually to you is something very specific जो मुझे लगता है काफी सारे लोगों पे शायद apply हो सकता है, and anybody who's watching this video will benefit from the answer. So मैं ये पूछना चाह रही थी कि जैसे अभी because of COVID ऑफिसेज बंद है, स्कूल्स बंद है, हमारी वर्क लाइफ एंड पर्सनल लाइफ काफी ज्यादा इंटरमिंगल हो चुकी है, इन द सेंस दैट वी डोंट हैव अ क्लियर डिमार्केटेड स्पेस फॉर वेयर डू वी वर्क, वेयर डू वी हैव आवर पर्सनल स्पेस. एंड मेरे साथ तो ये बहुत टाइम से हो रहा है बिकॉज आई वर्क एज अ यूट्यूबर, सो मेरा तो हमेशा से ही वर्क फ्रॉम होम ही चल रहा है एक्सेप्ट फॉर व्हेन आई एम ट्रैवलिंग एंड क्रिएटिंग कंटेंट. ऐसी सिचुएशन में जब लोग घर पे हों, आई फील लाइक दीज इश्यूज गेट ऑल द मोर एग्जैसरबेटेड. So आप क्या कहना चाहेंगे कि how can people cope up with these issues, especially when they're working from home or studying from home?
सही बात है. देखिए, I think this COVID pandemic has taught us a lot. One कि हमें क्या करना चाहिए. Definitely अगर हम work from home भी है, तो we need to have a proper routine, personal space, your own space. I think that is also important. Taking frequent breaks after every half an hour you sit. Take a break for about 5 minutes or 10 minutes. So I think that is important. And stretching yourself, you're stretching your muscle, because if you are online for a long period of time, so it can strain your eyes. So the point is that we can't get away from that. So what we can do is we can take breaks, stretch ourselves, drink a sip of water, because after all we have to work, we have to continue. These are difficult situations, and also at the same time questioning yourself that okay, these are difficult period, I will get over it. I know that these are difficult time for me, for my family. Talking to yourself and saying okay, motivating yourself up, or say interacting with friends or connecting with friends in spite of your busy schedule, what you are at home, will help you. And because being connected, taking breaks or exercise or physical activity, so all these are important to get away from the rut of your routine which is there, and be within that, and maybe that will help you in that situation.
तो ये तो हो गई वर्क फ्रॉम होम एंड स्टडिंग फ्रॉम होम की बात, एंड राइटली सेड दैट वी शुड ऑल take breaks and not just overwork ourselves all the time, because I think nowadays people also have this tendency कि successful होना है तो ज़्यादा काम करो और जितना ज़्यादा काम हो सकता है उतना करो, and कोई भी breaks लेने को prioritize नहीं करता. बट एक खास तौर पे टर्म है जो आजकल मुझे काफी सुनने को मिलती है, एंड आई वांटेड टू आस्क यू आल्सो. सो आई हर्ड ऑफ दिस टर्म कॉल्ड कोविड PTSD. सो व्हाट इज दिस? इसके क्या सिम्टम्स हैं एंड हाउ कैन दिस बी ट्रीटेड?
PTSD means post-traumatic stress disorder. It's a stress condition, stress-related condition. इसमें जो stress होता है, which is overwhelming stress. It's not a stress of day-to-day life. मुझे ऑफिस जाना है, बॉस ने डांट दिया, ये इट्स नॉट लाइक दैट. इट्स अ समथिंग वेरी सीवियर एंड सीरियस इवेंट विच कैन हैपन. नाउ कोविड में क्या हुआ कि से देयर हैज बीन फ्रीक्वेंट डेथ्स विद इन योर कॉलोनी, डेथ्स इन इन योर फैमिली, और आपके पड़ोस में डेथ्स हो गई हैं. और उसके अलावा जब आप आईसीयू में एडमिट थे तब वहां पे बगल में जो है किसी की डेथ हो गई बिकॉज दैट वाज आईसीयू सिचुएशन. बहुत सारे गैजेट्स थे वहां पे बिकॉज यू वर देयर फॉर फ्यू डेज इन आईसीयू. So when there is a very severe and devastating stimulus or stress, this can lead to a PTSD, that is post-traumatic stress disorder. इसको डायग्नोज करने के लिए या पहचानने के लिए PTSD उसके लिए ये है कि एक तो इंट्रूसिव मेमोरीज होती हैं, आपको बार बार फ्लैशबैक्स आएंगे और आप उसके बाद आपको ड्रीम्स आएंगे उस चीज के, या आपको नेगेटिव जो है इमोशंस होंगे, जहाँ पे एंजाइटी है या एक तरह की इरिटेबिलिटी हो सकती है, या आप उस तरह से रिलेटेड सिम्टम को अवॉइड करेंगे. आपको हॉस्पिटल में आपको हुआ तो हॉस्पिटल जाना अवॉइड करेंगे आप, या आपकी नींद में प्रॉब्लम हो सकती है. So all these symptoms may be there along with some mix of anxiety, sadness, but important जो symptom होता है जो differentiate करता है बाकी condition से, anxiety, depression से, वो ये है कि इसमें intrusive memories are there, flashbacks are there, where there are dreams about those horror incidents are there, which keep on coming and haunting you and which disturbs a person. And in COVID period this has happened, going to hospital where there was no oxygen available, और वहाँ पे you could see a person dying in front of you. It was such a traumatic event, and this trauma can have a very serious implication and which.
तो इसकी course of treatment क्या होती है? Like अगर ये हमारी discussion सुन के किसी को लगे कि उनको PTSD, they are experiencing these similar symptoms, so how should they go about treatment or therapy? What is the best course of action?
One thing is that yes, it is a completely treatable condition. So इसमें हम medicines देते हैं और इसमें अलग अलग किस्म की थेरेपी होती है, जिसे हम बोलते हैं cognitive behavior therapy, एक जिसको हम स्पेसिफिक बोलते हैं trauma focus CBT, आई डिसेंसिटाइज. तो अलग अलग किस्म का ट्रीटमेंट होता है, दवा से होता है, मेडिसिन से होता है, और मेडिसिन के अलावा साइकोलॉजिकल ट्रीटमेंट भी होता है. It is to be treated and a proper assessment is required, and there is a proper treatment and management available for this condition.
That's very heartening to know that this is a treatable condition and anybody who's suffering can definitely consult a professional for it. I've also had a good experience with therapy always, so I'm very pro talking about mental health, because I remember when जैसे मैं अपना खुद का एक personal experience share करूँ तो in the first lockdown I was I don't know, somehow feeling very low all the time, and हमेशा मन करता था कि मैं कोई काम ना करूँ, वीडियो एडिट करने का मन नहीं करता था, कोई काम करने का मन नहीं करता था, and I would always look for excuses to not do my work, मतलब मेंटली ही. एंड ऑब्वियसली मुझे कोई ऐसे मॉनिटर करने के लिए भी नहीं था, तो मुझे ऐसा लगता था कि मुझे काम करना ही नहीं है, मैं टीवी शोज देख लूंगी, मैं कुछ भी कर लूंगी, आई विल टॉक टू फ्रेंड्स ऑन फोन, बट आई विल जस्ट नॉट feel like working or look for excuses. So I think that is one of my personal experiences also. Isliye I think this discussion is all the more very touching for me ki we should talk more about therapy and we should talk more about mental well-being.
I think you explained very nicely. I think anyone who is listening to you will know that because I am talking from other side of it, and you are talking from your experiential side of it, and you have nicely explained.
Yes.
And this is what exactly, and also I would like to tell you one thing that कभी-कभी क्या होता है कि जो साइकेट्रिक इलनेसेस हैं या प्रॉब्लम है उसको हम सीरियसली नहीं लेते हैं। हम सोचते हैं ये तो ऐसे ही होगा, हम इसको यहाँ घुमाने ले जाएंगे, शिमला ले जाएंगे या मसूरी ले जाएंगे, उससे ठीक हो जाएगा। बिकॉज पीपल डू नॉट अंडरस्टैंड दैट हाउ मच डिस्ट्रेस इट इज कॉजिंग, जैसे मैंने पहले कहा। बिकॉज वन हु सफर्स इट कैन ओनली नो अबाउट द डिस्ट्रेस। बिकॉज हमें लगता है कि चोट लग गई है तो उसको पेन हो रहा होगा, वो एक डिस्ट्रेस है, बट साइकेट्रिक इलनेस का भी डिस्ट्रेस होता है। The person who is going through will only know about it. I think you nicely explained. I think anyone listening will know that these are very distressing. These are the kind of symptoms one has, and I think you explained it very nicely. And also you gave a very important message also. Doing therapy will also help you. Taking treatment also helps you. We should not avoid taking help. I think that is very, very important. In fact, I will just want to point a quote here that recently for children, adolescents, the UNICEF has published a report where 14% children, 1 in 7, have these psychiatric problems, depression, anxiety, and so on. So, usme India, 21 countries की study है. The concerning part is 4 out of 10 in India only wanted to seek help. That means 6 were not wanting to seek help, whereas in other country it was 8 out of 10. So 4 out of 10 versus 8 out of 10.
That's actually a very concerning statistic. Only 4 of 10 wanted to seek help. So yeah, that just means that this discussion is all the more very important. कि we do talk about mental health, we do prioritize it. और आपने भी जो point बोला मुझे बहुत अच्छा लगा कि ये distress जो होता है इसको कई लोग avoid कर देते हैं, ignore कर देते हैं. जैसे even in my case, I think I could have easily ignored it and just gone about my life. But मुझे पता था कि this is not normal behavior क्योंकि मैं normally ऐसा नहीं करती. So that's definitely something that I should address. So how can somebody go about, even thinking कि क्या awareness होनी चाहिए, क्या education होनी चाहिए और कैसे help ले?
Okay, that's an important point. I will tell you. Like one is that knowing self about, जैसे मैंने पहले कहा, the health literacy और mental health literacy, being aware of your own problems and पहले तो अपने आप को समझना, इसको हम बोलते हैं सेल्फ असेसमेंट और सेल्फ मैनेजमेंट। और कुछ हद तक हम उसमें अगर मुझे कोई प्रॉब्लम है तो ऑब्वियसली वी ट्राई टू हेल्प आवर सेल्फ इन सम वे और द अदर। दूसरा हेजिटेंसी है बिकॉज ऑफ स्टिग्मा इज देयर। और तीसरी है कि पीपल विल से कि कमी मेरे अंदर है, बिकॉज योर बॉस में नॉट बी गुड, या आपके अंदर प्रॉब्लम है, या आपका माइंड वीक है। So that is why people are a bit reluctant to talk about it, and also reluctant to seek a help about it. So there are many reasons for that, no doubt about it. और उसके ऊपर सबसे बड़ा है कि सर्विसेज अवेलेबल। देखिए, we have to see country as a whole. ठीक है, दिल्ली में आप जाएंगे थोड़ी सी दूर पे भी 2 किलोमीटर पे भी आपको साइकियाट्रिस्ट मिल जाएंगे, प्रोफेशनल मिल जाएंगे। बट थिंक अबाउट अ रूरल एरिया, थिंक अबाउट अ रिमोट एरिया जहाँ पे 100 किलोमीटर्स पे भी कोई हेल्प नहीं अवेलेबल होती है। तो प्रोफेशनल्स है, मेंटल हेल्थ प्रोफेशनल, साइकियाट्रिस्ट, साइकोलॉजिस्ट, इनकी संख्या बहुत कम है एज कम्पेयर टू अदर कंट्रीज। हालांकि नंबर अभी बढ़े हैं रिसेंट टाइम में, बट स्टिल दे आर लेस। एंड वी हैव टू सी वन दैट पहले अपने आप की प्रॉब्लम को पहचाने, समझें उसको, और एक मोटिवेशन रखें कि ठीक है, आई नीड टू गेट अवे फ्रॉम इट। देन इमीडिएटली आपको साइकियाट्रिस्ट से मिल, अगर नहीं है तो कोई बात नहीं, आप किसी भी डॉक्टर से मिल सकते हैं। अगर आपके आसपास प्राइमरी हेल्थ सेंटर है वहां पे भी डॉक्टर से मिल सकते हैं, दे आर ट्रेन्ड फॉर ऑल दिस। अपने जनरल प्रैक्टिशनर से आप मिल सकते हैं। और बहुत सारे भारत सरकार के प्रोग्राम है जहाँ डॉक्टर्स को साइकियाट्री की ट्रेनिंग दी जाती है, दे आर बीइंग ट्रेन्ड प्राइमरी हेल्थ सेंटर में। तो द पॉइंट इज दैट सीकिंग हेल्प इज इम्पोर्टेंट। गो टू नियर बाई एनी प्राइमरी हेल्थ सेंटर और एनी डॉक्टर, and if needed he will refer to health center। but मैं ये कहता हूँ 80% प्रॉब्लम उसी लेवल पे ठीक हो जाएगी। इसीलिए देखा गया है बहुत सारे लोग डॉक्टर के पास ना जाके बहुत फेथ हीलर के पास जाते हैं, मंदिर हैं या दरगाह है, बिकॉज दे थिंक दैट साइकियाट्रिक इलनेस इज बिकॉज ऑफ सुपर नेचुरल पावर, इवल्स आई, किसी की बुरी नजर लग गई है या इसलिए ऐसा बिहेव कर रहा है। तो हमारे कल्चर में बहुत बड़ी धारणा है ये कि दिस इज नॉट अ मेडिकल इलनेस, इट इज बिकॉज ऑफ सम ऊपरी हवा और ऊपरी चक्कर या इस तरह से। तो दे विल रादर टेक अ पर्सन टू अ फेथ हीलर। सो आई थिंक द इम्पोर्टेंस message is that be aware about it. We need to educate people. It's like any other medical illness, and the bottom line is it's completely treatable condition if you identify early and there is a management available at every level. तो और किसी भी डिस्ट्रिक्ट हॉस्पिटल में जा सकते हैं तो डॉक्टर से अपनी बात को कह सकते हैं।
Wow, this was an education in itself कि इतनी easy है help seek करनी. It's just that people should know about it, have awareness, and also I hope things change soon for the better and more people seek help. I think this was a very nice conversation. It was truly an eye opener और कितने सारे अच्छे points निकल के आए हमारे इस discussion से. So, Dr. Sagar, I would wholeheartedly like to thank you for being a part of this conversation and wishing you a very, very happy World Mental Health Day. And I hope ये conversations चलती रहें and there is progress in our country, हमारा statistic change हो and more people come to you, come to other professionals, seek help and make an improvement to their life.
Thank you so much. It was wonderful to interact, and again, my wishes to everyone on this World Mental Health Day. And it was wonderful interaction, and I hope we continue our discussion and dialogue later on also. And I must thank your team and for this great opportunity. Thank you so much.
So guys, that was it for today's video. I hope you found it insightful and I hope there was something for you also to learn from it. मेरे को बहुत अच्छा लगा डॉक्टर सागर से बात करके and after this session I am truly very inspired to seek help whenever required, or if somebody in my vicinity also requires help, to talk more about mental health issues. If you found it insightful as well, let me know in the comment section below and I will see you next time in another video. Bye bye.